You walk into your gynecologist's office, maybe a bit nervous, maybe already dealing with strange symptoms, night sweats, mood swings, insomnia, or just a sense that something inside you is shifting. They smile, ask a few questions, maybe run some blood tests. Then, almost casually, they say, "It's just menopause." And that's it. Case closed. You leave more confused than when you walked in, thinking, is that really all there is? Because what they don't tell you might just be exactly what you need to hear to take back control of your body and mind. Here's the truth no one's shouting from the rooftops. Most gynecologists were never properly trained in menopause, and honestly, it's not even their fault. Medical education has focused so much on fertility and childbirth that the hormonal chaos that comes after gets brushed aside like an inconvenient afterthought. Yet menopause lasts just as long, sometimes even longer, than your reproductive years. Still, most women walk out of that appointment with little more than a prescription for HRT, if they're lucky, or a vague suggestion to eat better and get some rest. But wait, what if your anxiety isn't just stress? What if your vanishing libido, joint pain, or even heart palpitations aren't just in your head? One of the most overlooked facts is that estrogen receptors are everywhere, not just in your ovaries. They're in your brain, your bones, your skin, your bladder, and your heart. So when estrogen starts to drop, slowly but surely, your whole system feels it. But does anyone warn you that your skin might start itching for no reason? That your bladder could suddenly become sensitive or even start leaking when you laugh or sneeze? That your cholesterol might spike even though your diet hasn't changed? Nope, because those changes are often dismissed as normal aging. Except they're not just aging, they're signs of a hormonal shift, and they deserve more than a 2-minute footnote at the end of your annual checkup. Let's talk hormones for a sec. When women ask for hormone testing, they're often told it's unreliable, or there's no point testing if you're still having periods. But guess what? That's not entirely true. Sure, hormone levels can fluctuate wildly, but they can still give you clues, especially when tracked over time or considered alongside your symptoms. But again, most doctors don't have the training or time to walk you through that process. So instead, they rely on textbook definitions like, menopause is confirmed after 12 months without a period. That's fine for charts and statistics, but your life isn't a textbook. Here's another thing no one says out loud. Perimenopause, the stage before menopause, can begin as early as your late 30s. Yes, your 30s. You might still have regular periods, but if you're feeling more anxious, waking up drenched in sweat or forgetting why you walked into a room, it might not be stress. It could be the start of a transition no one warned you about. And this phase can last for years, sometimes a whole decade, without a single doctor naming it for what it is. Now, let's get personal. If you've ever gone to your gynecologist and felt brushed off, I want you to leave a comment below. Tell us what they said or what they didn't, because your voice matters, and your story might help another woman feel less alone in hers. This space is about breaking the silence around menopause. No shame, no filters. And while we're at it, let's bust another myth, that menopause is only about hot flushes and mood swings. For some women, those symptoms never show up. Instead, they're hit with dry eyes, ringing in the ears, burning tongue, or even frozen shoulder. Ever heard of these being linked to menopause? Probably not, because doctors rarely make the connection. But thousands of women are finding out the hard way that these supposedly random problems have one thing in common: hormonal loss. Before we continue, something important. In the description of this video, I've left a resource that could really help you through this stage. It's something several women are starting to use and are seeing real changes. If you're curious, have a look later. It might be just what you need. And when you finally find a doctor who actually listens, they might suggest hormone replacement therapy. But even that comes with a fair bit of confusion. One minute you're hearing it's dangerous, linked to breast cancer, and the next it's being called a miracle solution that protects your bones, brain, and heart. So, which is it? The truth is, those early studies that scared everyone off HRT were seriously flawed. They used outdated methods and synthetic hormones on much older women. What rarely gets shared is this: starting HRT within 10 years of your last period, especially before turning 60, can actually protect your heart and brain, lower your fracture risk, and massively improve your quality of life. But how many women are ever told that clearly? Instead, many are told to just deal with it, as if this stage of life is something you simply endure. But here's the thing: you don't have to. You deserve real options, real support, and a real understanding of what your body is going through. Menopause doesn't just mess with your periods, it affects your identity, your relationships, your energy levels, your memory, even how you relate to the world. That's not just aging, it's a full body transformation, and it deserves respect. Now, let's talk about intimacy for a second. It's one of the quietest struggles in this phase. Doctors rarely bring it up unless you do first, and even then it's often brushed aside. But vaginal dryness, pain during sex, and loss of desire are incredibly common and totally treatable. Local estrogen creams or vaginal moisturizers can help hugely. But if no one tells you they exist, how are you meant to know what to ask for? Silence leads to suffering, and suffering in silence is no longer an option. Here's something else to think about. Menopausal women are more likely to be misdiagnosed with depression or anxiety and prescribed antidepressants, when in reality, what they might actually need is hormonal support. Yes, your mood swings might look like a mental health issue, but what if they're biochemical? What if balancing your hormones naturally, or with personalized help, could clear the fog without meds you might not even need? That's not to say antidepressants aren't helpful for some women, but they shouldn't be the default fix for hormone chaos. Speaking of your mind, brain fog, forgetfulness, struggling to focus, they're not signs you're losing it. They're real, common symptoms of the hormonal roller coaster your brain is riding. Estrogen plays a massive role in cognitive function, and when it dips, your brain has to work extra hard to adapt. Hardly anyone talks about this, but knowing why it's happening helps you stop blaming yourself. You're not lazy, you're not getting old. Your brain is fighting to keep up in a body that's rewriting all the rules. By now, you might be realizing just how much you weren't told, and maybe feeling a bit angry about it. That's okay. You're allowed to be disappointed. But the important thing is, you're here. You're learning. You're taking your power back. And that means that next time you walk into that doctor's office, you'll be armed with better questions. You'll ask about HRT, about bone density, about heart health, about libido and memory. You'll speak up and demand answers that go beyond "it's just menopause." If you've made it this far, thank you for sticking with me. You're part of a quiet revolution, a wave of women refusing to be silenced or sidelined in one of the most important chapters of life. And trust me, this is only the beginning. If this video opened your eyes, hit subscribe, because in the next one, we're diving into something nobody talks about, and you definitely won't want to miss it.